Namaskar. Today we are going to discuss further on Central Services Medical Attendance Rules 1944. So far we have seen applicability, who are all eligible, what is the AMA, that is Authorized Medical Attendant, and family details. And now we will discuss about medical advance for treatment and consultation, etc. Medical advance for indoor treatment, 90% of the estimated cost of the treatment on the basis of the approved rate, whether it is CGHS rate or medical attendance rate, whichever is applicable. Both are same. If medical attendance rules rates are not available, CGHS rate can be taken. So based on those rates, 90% can be paid. And these rates, the estimate will be provided by the doctor, the treating hospital doctor, and the advance can be made more than one time also. Suppose if the treatment is prolonged, one longer time it is going on. So first time they are paying some value of estimated, then again it is treatment is extended, whatever it is. So overall 90% is the limit. At every time they have to calculate, and once the patient is discharged or completion of treatment, the claim has to be submitted by the employee concerned and settle the advance paid. No, adjustment of advance. This is what I told. Employer has to submit final claim for adjusting advance within 1 month of completion of treatment. In case of refund, suppose the estimate happened to be or turned out to be more than the actual treatment, so you have to naturally refund the value. Normally that has to be refunded in lump sum, but in some special cases where the amount is more, even up to 4 installments can also be allowed. And if the government servant is too ill to apply for advance, if somebody is very ill, he cannot write, yes, spouse can give application or the legal act. With that, office can provide advance. These are all provided in the rule. What is treatment? It is definition actually. Treatment is use of all medical and surgical facilities available at the recognized hospital. Normally, all the government hospitals are recognized hospital, and other hospitals are empaneled. They are kept in the panel for a specific period. There also you can treatment. Whatever they do for medical facility, normally which is not admissible under medical attendance is food. That is diet, etc. They may give, and a special tonic is not allowed. Cosmetic things are not allowed. Items provided for hygienic things also not provided. So it is purely for treatment and related things. So the employment of pathological, bacteriological, radiological, these are all lab tests. Radiology is X-ray and other things, or other methods, as are considered necessary by the AMA, authorized medical attendant. We have already discussed who is authorized medical attendant, so I don't need to explain again. Government doctors or private doctors nominated by the head of the department are considered as authorized medical attendant. So supply of medicines, vaccines, Zira, and other therapeutic substance as are normally available in the hospital. The idea is generic medicine has to be given, nothing else. It means actually generic medicine. Normally generic medicine is encouraged. Unless there is exception, generic medicine is not available, branded only can be given. Doctor has to give a certificate for that also. No. And accommodation also, for treatment, there are three types of accommodation: general accommodation, semi-private, and private. We will discuss about the eligibility separately. So these are all considered to be treatment. Nursing. Apart from that, nursing also. So when the person is admitted in hospital, nursing facility is provided. So that is also taken as treatment. But these are all made essential by the hospital. It's not something which the government surrounding the patient opts for. Any special concern is not allowed in the medical attendance rule. So, and apart from that, the specialist consultation also. When somebody is admitted in hospital, at times specialists have to be called. They will come and inspect and give their opinion and treatment also. So these are all allowed as treatment. And treatment is not like diet is not treatment. Provision, suppose the government servant wants private accommodation only. He is entitled to general or semi-private, let us say. So that is not considered to be normal treatment. So he will not be entitled to the higher accommodation than the entitlement. Under certain circumstances, it is allowed. We will discuss separately. And the government servant, the eligible members of family shall be entitled free of charge to medical attendance. The meaning is all the medical facilities should be provided free. Okay. Which hospital will give freely? Even government hospital, when we say that we are government servant and our salary is this much, they will make some nominal charge, which is fully reimbursable. There is no limit at all. So whatever you spend, that is reimbursed. That is what this rule says. You are entitled to free treatment. So since you are made to spend money for treatment, it is reimbursed, but with a rider. For every treatment, they have fixed some rate. So the payment will be within that rate only. And exception is separately we'll discuss in the appropriate video. Okay. So if he spends money, he is entitled to reimbursement, including the charges made by AMA. AMA can charge for his consultation. Normally, 10 days are allowed for consultation by AMA with 4 consultation fee. Beyond that, now if the treatment is consultation is continued, he has to refer to hospital only. Certain circumstances he can extend, but normally it should not extend more than 10 days of consultation by AMA for a maximum of 4 consultation fees. Not all the 10 days will pay consultation fee. Now, another point, when the place of illness, that is when the person falls ill, is more than 8 kilometers from the AMA's place. It is like somebody visits some place. So if, when he falls ill, he has to travel more than 8 kilometers to see the AMA or government hospital or the empaneled hospital, nearest empaneled hospital. And if it is more than 8 kilometers, so he can claim traveling allowance also. And another thing, suppose the patient is too ill, he cannot travel. So the doctor, AMA, can visit the place of the person who falls sick and he can claim to and fro. That is also allowed. So these reimbursement travel expenditures are provided by submission of certificate by the competent doctor. Doctor is AMA only. He will give the reason why he has to be given, the patient is to be given traveling allowance because the distance traveled by him is more. Or why I am claiming as a doctor because I had to visit to the patient. He was too ill to travel, so he could not move. So I went. All those things he will give in the certificate. With that, traveling allowance also, that is conveyance allowance, is paid. Consultation with specialist. If the AMA considers that consultation with the specialist is essential for the management of the patient's health, he can refer and that special charge also will be paid. Or if the patient is too ill to travel to the specialist, the AMA can call the specialist for which traveling allowance will be paid to the specialist also along with this specialist charge. Now the consulting fees as of today, per consultation is 350 rupees. It is very meager when you compare with the city. Okay, something is better than nothing. A village, it might be a reasonable rate, good rate also, because I have seen even now in villages 100 rupees are collected by doctors. There are very noble doctors who charge less than 100 also. But in city, 350 is very nominal. But recently it is raised to 350 per consultation for outdoor consultation as well as indoor treatment where doctor comes and gives his opinion. For that consulting fee also is paid. And the indoor treatment for a day, 2 times it can be provided. All those things we'll discuss separately. Medical treatment. As I already told, medical consultation, medical treatment also, every government servant and his family, entitled family members are eligible for free treatment. Of course, the rider is wherever charges are made. If it is government hospital, it is fully paid. If it is empaneled hospital, the rate fixed by government will be paid. The rates are either fixed under CSMA rules, that is Central Service Medical Attendance rules, or CGHS rates. CGHS rates periodically they revise. Now it is, I think, overdue. They will revise. So that rates are paid. And once you spend money, you can raise the claim for reimbursement within 6 months of completion of treatment. If somebody is admitted in hospital, the procedure is we will discuss separately. See, normally AMA will refer for admission, and you can go with that. For treatment, you have to take office permission also. With that, with the AMA's reference, you have to take office permission, and then you can take treatment. But for emergency situation, there is no such thing. You can directly go to hospital and take treatment and give the reason why you could not follow the referral procedure, that is AMA's reference and office permission, etc. Under emergency condition, there is no such conditions. Okay, now we have briefly seen medical attendance rules under for treatment, etc. In the next video, we'll see how the claims are made and how the relaxations are provided in the claim also. Namaskar.